Hi, my name is student Dr. Matthew Shannon. I've made 4 board-style OMM questions and I will go through them now. I'm reading off my computer so that I can know what to say, so I'll just show you. So I wrote these questions. Cool. Okay, the first question. A 23-year-old female comes in with a complaint of shortness of breath. She has a previous medical history of asthma that is well controlled. You decide to perform an osteopathic structural exam and you notice that ribs 3 to 5 on the left do not want to move into inhalation. What is the key rib? A. Rib 3 on the right. That is incorrect because we noticed there was a restriction in the motion of the ribs on the left. B. Rib 3 on the right. Rib 3 on the left. This answer is correct because first we noticed the restriction of the ribs and inhalation on the left, and to go into the explanation of the key rib, we know the mnemonic BITE, so bottom inhalation, top exhalation. So since the ribs do not want to move into inhalation, its ease is exhalation. So top exhalation. So the top of ribs 3 to 5 would be rib 3. Letter choice C, rib 5 on the right. Just to clarify again, since the dysfunction is on the left side, this answer is obviously incorrect. D, rib 5 on the left. This answer is incorrect because this would be an inhalation dysfunction. So bottom inhalation. Alright, moving on to number 2. A 56-year-old male comes into the clinic with a complaint of lower back pain. The patient describes a new workout routine that involves full body workouts multiple times a week. You decide to perform an osteopathic structural exam, and during the style screen, you notice that the transverse process of L3 is more posterior on the left. You have the patient flex forward, and the transverse process becomes more symmetrical. So that's a key finding in this question. What is the diagnosis? Choice A is L3 flexed, rotated side bent left. So this is the correct answer. We noticed that L3 was more posterior on the left, so that means it's rotated left. We also noticed that when the patient flexed forward, the somatic dysfunction corrected itself, so that indicates it's a flexion dysfunction. And just following type 2 mechanics, we know that it's going to be the same side. Rotation and side bending will be on the same side with a flexion or extension dysfunction. Number 3. Oh wait, I'm sorry, I need to go and explain the other choices. So choice B is L3 flexed, rotated, side bent right. So because of the original finding of the transverse process of L3 being posterior on the left, we know this one's obviously not correct. Choice C, L3 extended, rotated, side bent left. We know that flexion fixed the asymmetric transverse process, so it's not an extension dysfunction. Choice D, L3 extended, rotated, side bent right. This one is probably the most incorrect because A is extension, we know it's a flexion dysfunction, and B, it is rotated side bent right. We do know that it's rotated side bent left because of the posterior transverse process. And the the original question. All right, number 3. An 84-year-old female presents to the clinic with a chief complaint of shortness of breath. She has a previous medical history of COPD. You decide to perform an osteopathic structural exam and notice that ribs 6 to 8 are restricted, moving into exhalation. The diagnosis is determined to be ribs 6 to 8 inhalation dysfunction on the left. What muscle is associated with the key rib? So, first thing is, we need to know what the key rib is. And since it is an inhalation dysfunction, we know the bite mnemonic. So, it's inhalation. So the bottom rib of 6 through 8 will be the key rib. So it's rib 8 is the key rib. So the first choice A, is anterior scalene, and that is incorrect because the muscle associated with rib 1 is anterior scalene. Choice B, middle scalene. Incorrect, because rib 2 is associated with the middle scalene. Choice C, serratus anterior. That one's correct, because serratus anterior is associated with the key rib 8. Quadratus lumborum, that is associated with rib 12, and that is choice D. So the correct answer is C, serratus anterior. Question number 4. You are rotating in an OMM rotation, and your preceptor identified a counterstrain point that they want you to examine yourself. Your preceptor tells you to find the iliacus counterstrain point. Which location is the iliacus counterstrain point? Choice A, 2/3 the distance from ASIS to midline. That is incorrect. That is the psoas point. Choice B, 1/3 the distance from ASIS to midline. That's correct. That's the iliacus counterstrain point. Choice C, 2 inches superlateral to the pubic symphysis. Incorrect. That is the low ilium point. Choice D, descending ramus of pubic bone. That would be incorrect as well. It's a low ilium flare-out. Well, that concludes my questions for today. I appreciate you watching my video and all of the assistance with retaking this COMAT. Thank you.